The main idea behind simulation, and this was harped upon when I did my fellowship, is that no matter who the learner is, you can expect that they will have to make mistakes on the route to becoming proficient. It's just the fact of learning medicine. With simulation, we get to make those mistakes here in a sim lab with a mannequin that we can resuscitate and have you do it over and over again until you're proficient. The simulation lab I like because we can teach more than just the subject at hand. So while we're working on, for example, chest pain, we can focus on EKG interpretation, how to read a monitor, and the things you can do right then and there stat when a patient starts to decompensate. And I have staff and I have support from Mercyhealth to continue doing this well. Well, the beauty of our simulation lab is while I may work mostly with residents, we've got staff that work with every level of anybody that comes in contact with patients. And so just going cranial to caudal, even with this mannequin, we can work on everything from pupillary response based on drug intoxication, to intubating, to listening to breath sounds, and even placing Foley catheters and simulating GI bleeds. With our female mannequins, we can even simulate childbirth from everything from a complicated delivery to breech. And so it's a full service simulation center, and we're only continuing to add to more of this every day. I tend to think of our simulation program with three main arms. We've got EKG tutorials that we do for the residents. It's sort of interactive. We've got special ICU procedure labs where we place central lines and practice intubations and arterial lines. And then we've got our full-on sim days, which we call our grand round simulations. What that helps us do is not just the most common pathologies that the residents may see, but also the ones that they might not. So if you don't work in an area endemic to sickle cell or cystic fibrosis here, we can put you in contact with any disease that exists out there that you didn't actually get in training. You know, when it comes to what I hope the residents take after they graduate from here, it's not just a bonding experience, having been under stress during the simulation lab, but also learning how to take care of the full patient experience, the family members that want to know what's going on with their patients. I'll never forget in residency, I had to do a pediatric case, and I had a patient, the mannequin, but we had hired some actors to play the mannequin's mother. And I learned then and there to also put the whole family in the driver's seat as far as knowing what's going on with the patient and making sure they stay abreast of all our clinical decisions.
Some of the sim activities that we did last year consisted of us getting together in like 4 to 5 people, kind of simulating acute emergent cases mostly. So things we would see on the floors in the emergency department, things like hypertension urgency, emergency, preeclampsia, eclampsia, kind of exactly what to do in the acute setting. We kind of play it out. We get to watch each other kind of do it and learn from each other as well. So my favorite part for sim activities would probably be like getting into groups, getting together and actually working through the case together like it would be in a real setting. It's really fun, like camaraderie between residents and kind of like, you know, kind of a competition in a way, but in a learning experience, it's really good. So one of the cases we had in simulation was hypertension urgency emergency. I actually had one of those cases in the emergency department. It was pretty much identical, similar management. Obviously each case is a little bit different, but it really helped in real life as well.
So yeah, during orientation, we were able to do some really cool, amazing simulation cases. Those are some of the cases that we've read about in med school, but weren't able to actually get the hands-on practice. So just being in this lab and being able to actually use the mannequin and do everything hands-on, where I was able to actually really understand where everything was coming from, and it really added up into my knowledge.
Yeah, I think so. During our orientation, we ended up being in the sim lab, and we actually got to understand the pace of, like, I guess, a critical scenario, so we could help patients when it does come the time for that. It did mimic it very well. We did feel the intensity. We were all kind of sweating. We definitely learned how to apply some medical knowledge, the things that we've been reading about for time, into a scenario without actually having an alive patient. I think the robotics here mimicked it very well. Yeah, so Dr. Amuka, after the sim lab was over, we'd actually go outside and we'd have a debriefing session. He would actually go over the diagnoses, the workups, anything that we may have missed or we may have got as well. So he was giving us both positive and positive reinforcement actually to move forward. He used a lot of evidence-based medicine in order to back up his claims and things that we should have done or things that we did do and why we did them. So I thought it was very educational.
Yeah, we also received a lot of resources from him too, just to kind of read up on everything and make sure everything's making sense to us.
Mm-hmm.
So I think the simulation lab offers the residents a really good opportunity to get hands-on skills before they get into the situation in the hospital. So it's a little bit lower risk environment, less judgmental. They can really work collaboratively to build those skills before they actually have patients to care for.
Okay, after the simulation is done with the residents, the Dr. Amuka comes up and all the residents have to get in the room and they go through a debriefing session where Dr. Amuka presents the case and then goes through with the evidence-based approach to how each simulation needs to be done. And so I think that it reinforces their learning, what they did, and also just makes them more confident in their approach in the future patient care.